they're not cleaning out their hydro tubs. You're sitting in a tub of other people's dead skin cells and bacteria. Honestly, I'm gonna be honest, this is awful. They paid off the inspector.
Oh my gosh.
Absolutely paid off the
Where
inspector.
they were about to fail and they paid them off,
Well,
or
I'm sure they were out of compliance and they somehow worked it out, but from then on, I guess it was a regular thing that if and when the licensing came, it was just a 800 bucks under the table.
this is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and welcome back to Med Spa Mayhem. Today, I'm speaking with Elizabeth Gersten. She is an esthetician who has been in practice for 29 years now, and she comes to us from San Diego, California. Thanks so much for being here today.
Hi, Dr. Kate. I'm excited. I'm so excited about your book too, by the way.
Yeah, well, I'm super excited about that. As of this recording, it's the day after the release date, so
Yeah.
people are starting to actually read it now.
Congratulations.
Thank
Mhm.
you. So, I was hoping you could tell our listeners a little bit about what you do, what you've done throughout your career, and what you're doing now.
Sure. I'm a California licensed esthetician for a little over 29 years now. And I've worked in a variety of different type of settings, such as a five-star hotel spa, luxury destination spa, private spas, day spa, plastic surgeon. So I've had a lot of experience in different. I've also had my own practice, by the way, for over 8 years. I don't any longer. I'm currently retired from my practice. COVID kind of put everything together and it was time for me to retire. So I'm now actually an instructor in aesthetics, but I do have a long and somewhat sometimes sordid history of aesthetics. The good, the bad, and the ugly.
Oh, yeah. Well, we know all about that. So, what kinds of services did you provide in all those places? Was it mostly facials? Did you do other kinds of services?
I did European facials, including the hand and arm and the wrap, paraffin wraps, and all of that, the more luxury type of treatments. But
Hmm.
then I also provided in different, locations where I was, chemical peels, microdermabrasion, body treatments such as wraps and scrubs under a Vichy shower, LED therapy, oxygen facial. I did acne treatments, dermaplaning, and a variety of different medical grade peels like the Vide peel. I also did TCA, Gessner, glycolics, alpha beta peels, lactics, just common things estheticians can do. That's about it. At the plastic surgeon, of course, it was a much more clinical setting. I worked that end where we did more of the chemical peels. And then at the day spas, it was more of the luxury. Some were more luxurious than others. Others, people came just for regular facials. It just depended. But those are mostly the kind of services I offered.
And are you're teaching now
I am. I'm an
at an
instructor.
aesthetic school? So, you're
Yeah,
teaching people how to become new estheticians.
that's right.
I'm curious to know how the education currently compares to what it was like 29 years ago when you were starting.
Well, Doug, I have to say, kid, I was shocked actually when I started teaching again because I didn't realize that in 2022, the requirements in California had changed for licensing. So now there is no practical exam any longer in California. My education, although it's the same amount of hours, it was different in the sense that now your theory is done online where you watch a little blurb of something and then you answer a multiple choice question at the end. And then there is no more practical exam. So you're not required to show anyone that you're proficient in any of these services you're providing. So that was a big shock for me. My education was spent in 8 hours a day in a classroom, actually writing down notes with a pencil and paper and listening to a lecture, and for a good 8 hours a day, and for 6 weeks until we were allowed to even touch other clients or work on clients. It was just, it's a lot different now, and it concerns me.
So the amount of in-school lecture kind of learning is the same?
It's not.
It's not the
They
same. Okay.
their theory, I do lecture in the morning for an hour, and then the other 3 hours of my day is spent doing demos, and we do take clients. So, depends which of my students are ready for that. But there is basically no more theory other than what you do online here in this hybrid program.
Okay. And by theory, you're talking about what these different acids do to your
Oh,
skin.
the chemicals, electricity, all aspects of the skin function, anatomy of the face, the bones and the muscles of the face. I don't even know how to describe the difference because hardly anyone takes notes when they're even listening to me. That's all we did all day long. I still have my notes. I still have my textbooks. There's no real
Yeah.
text. There's no textbook. So there's nothing to really refer unless you
There's
go
no
back.
textbook. There must be online materials that you can
Correct.
access.
But I mean, to be honest with you, I don't think a lot of my students access that very often. And they're meant to be monitoring themselves as far as how far they're progressing in the theory online. But theoretically, you could wait till the last minute and do it all in 2 nights. If
And
you
do they have to have a certain amount of what we would call in medicine clinical experience, but like practical
Yes,
experience,
and
number
that's
of
my part is 300 hours of their practical experience. Their combined hours are 600 hours to complete so that you can take the exam to get your license. My part is 300 hours, and it's the practical part of it.
uh-huh.
Even though I do a little bit of theory in the morning, and I do help them with that because even though these kids are supposed to be doing this theory online, they really, when I speak to them about it, they really have no idea what they're talking about, or they're not grasping the concepts, put it that way.
So you had a number of stories that you wanted to share. I think that it's important to point out exactly why it's important for an esthetician to understand all this stuff. Peels are generally an acid that you put on the skin and gets the dead cells on the surface of your skin to slough off. There are lots of different kinds of peels that are used, and some are more aggressive than others, and people's skin is all different.
Mhm.
So it's super important for estheticians to understand how the skin reacts with these acids and how to manage them to make sure
Right.
you don't burn anybody, to make sure you don't have any hyper or hypopigmentation problems. Have you seen any of those kinds of problems in
Absolutely.
your
Those are just common problems you see in this industry. Over the years, I've seen people have scarring over their eyes because the hot wax was applied incorrectly or too hot or removed incorrectly, and actually remove skin. Because as you know, you can remove actually not just the because that wax adheres to your skin. So if
yeah.
you're you can actually remove skin, whereas hard wax adheres to the hair. I've seen lots of accidents with that. I've
Oh,
s
well, I myself have had those red streaks under the eyebrows. Those are
but this is
not
even
fun.
and this is actually skin is actually missing. So I've seen, that's on the smaller scale of things, but as far as reactions from burns, especially from chemical burns when people have combined them with another service such as microdermabrasion, where
Mhm.
that's completely contraindicated, but for some reason, that practitioner chose to use that. So, but as far as, things that have happened in spas I've worked in, I could give you a laundry list starting with, I've worked at a very high-end day spa that's been in business here in San Diego for over 40 years. I was told by the owner of the spa not to change the sheets on my bed every time between each client because it wasn't necessary since they're laying on a towel. We can just change the towel. You don't need the sheets. Now that's not something dangerous, but it's inappropriate. They had a hydrotherapy tub, which I worked out in other facilities as well. And the process for that is after the client is done, you wash out the tub, you fill it, and you put a disinfectant in, and you run it through the system for 20 minutes. And then you rinse out the tub. A
For
lot of
our listeners, what's hydrotherapy?
hydrotherapy is using water. Let's say you could say it's a jacuzzi in a bathtub type of thing. It's a little bit more intense than that and different. There are systems where they move up and down the body. in different sizes of jets to stimulate blood flow, to improve all kinds of health conditions and induce relaxation and so on. The protocol for that is to use the tub, and then there's a 20 to 30-minute process, because for 20 minutes, the disinfectant has to run through all the pipes and then you rinse it out. But in this case, this place was very big on cutting corners.
Right.
So they did not do that to the hydrotherapy tub. So imagine this. Probably some of your listeners have gone to a hotel and, great, there's a jacuzzi tub in the bathroom. I really doubt they're also using that proper procedure. So you're getting in that jacuzzi tub, and inside those jets are
All
skin
kinds of
particles,
bacteria from
especially for women,
fungus.
difficult infections from that with a distant, and all the grime comes out. It's disgusting. So basically that. Also, they would, at this particular spa, different facials, we had several different product lines, and different facials had different protocols. They didn't want to allow us access to a dispensary. They would prepare products from that particular facial and put it in small, like little taco sauce containers, and then assemble that into separate drawers for each facial. So if you were doing a Epicurean facial, you would get the Epicurean drawer. What they were doing, though, is they're buying the larger, the bulk size
The
product,
back bar size product.
back
Yeah.
bar size product. And when I went to the back one time and saw the owner's husband doing this, he takes out a container, let's say from the box, and it has a little bit left in it at the bottom, but he doesn't clean out the container. He was just adding new product on top.
Okay. Was
We
in
actually
there
were
over time.
mold growing in the bottom of those containers.
Ooh,
It's a very
okay.
high-end spa too, that was very popular and still is at this point. So those
So
were
just to, explain for our listeners who may or may not realize this, right? Your skin has a ton of bacteria on it, fungus, other stuff, dirt. And so anything from those tubs, if it's not cleaned properly, it's just getting stuck in the pipes or at the bottom of the tub. And then
correct.
you're introducing that to your next customer.
Absolutely.
And then with product, if you don't use the whole thing, it'd be like refilling your shampoo bottle a million times and never throwing it out. So over time, everything's moldy, is what you're
Well,
saying.
exactly. Yeah, I mean,
Blech.
these products do mold. There is expiration dates. They don't last
Yeah.
forever, and that's just basic sanitation procedures.
This is one of my questions for you, actually, because in many medical spas, so mostly what we're talking about today are regular spas, day spas, not medical treatments,
Right.
right? And as far as I know, estheticians in California can't perform medical treatments at all. Isn't that correct?
That's correct.
Yeah.
We can't perform anything invasive to the skin. No, nothing that pierces the skin. Interestingly enough, though, now in California, since the change in the licensing requirements for testing, they've let estheticians now do dermaplaning and lash and brow tinting, which I'll be honest with you, we were doing lash and brow tinting 30 years ago under,
Yeah. In Washington, that is also allowed for regular estheticians to
but in
do.
California, this was not allowed until 2 years ago. So dermaplaning is a procedure where you use a scalpel blade to remove the vellus hair from the skin. So it gives a very smooth appearance, and it does exfoliation as well. It takes out dead skin cells. So
Yes.
it's interesting to me that in California, they're now allowing you to use a scalpel on someone's skin, yet you can't use a tiny lancet, which is a needle used to puncture the skin, maybe to do a blood test or something. It's a tiny needle, and it's used to aid in extractions for acne.
Like milia and sebaceous hyperplasia and stuff.
Exactly. Yeah, it can't be removed without one. This is just, like you're talking about the regulation of different industry. That doesn't make any sense for licensing to allow that and not allow
Well,
lens.
yeah. So in Washington, unlike California, we have a second layer of master esthetician licensing where you can do extra training in some medical procedures, including lasers and microneedling. And if you get that additional education and training and certificate, then you can work under a physician to do some of those treatments. And in my clinic, I have 3 master estheticians who do not only the facials, but they do microneedling and some laser. The thing that you were talking about with dermaplaning, which I think people would be interested in because that's really popular. So you're using a surgical blade to scrape off the very top layer of dead cells and
Right.
those little hairs, the little
Mhm.
vellus hairs or those little peach fuzz that we get. And if you do it right, you're not piercing the skin. But
You're
there
right.
is always a risk of scraping or piercing the skin with that blade because you're literally using the same exact surgical blade that a surgeon would use to make a skin incision.
Right.
So
Oh,
that has to be done very carefully.
right. I'll understand how sharp they are.
Yes, they're ridiculously sharp. So hopefully people are very well trained and they're not, piercing the skin with that. Scraping is very common. You can get a little scratch from that. So hopefully places are getting sterile blades. It should be sterile and disposing of that after every patient. So you should never ever be reusing a blade like that because there's all kinds of stuff on that blade now. There's not just dead skin cells
Right.
and hair, but there's probably some blood products or other cellular debris
Absolutely.
from a person. You don't want that touching a new person.
Right.
I do worry that might be common. Those blades are pretty expensive. We go through a lot of them.
Interestingly, when a surgeon does a surgical procedure, he uses several, not just one scalpel. He uses several because it does lose.
It's
Uh,
not as sharp. It gets duller.
yes, estheticians are allowed to do it in California, and there's absolutely no training required. I myself learned under a plastic surgeon, and that's how I was able to do it when I did it. This was 15, 20 years ago. And I actually learned from the plastic surgeon himself. So it was taken much more seriously. Now I see estheticians not only are allowed to do it, but they're offering classes on TikTok and Instagram where you can pay $17 and get quote unquote certified in microblading. And they also say you'll be taking clients by the end of the week. Now, I don't know.
And I just want to clarify because you said the word microblading,
I'm
which is
sorry,
different. Just so, and for people listening, we've been talking about dermaplaning, which is that scraping. It's an exfoliation treatment. Microblading is a completely different treatment, which sounds very similar, but it's not. And that's the use of a scalpel and basically tattoo dye to do your eyebrows. So for people who want to enhance their eyebrows or redraw them in, or maybe they overplucked in the 90s, you can do microblading. That is quite the art. In Washington, you need a tattoo license to do that.
In California, you do not need a tattoo license, which is also very interesting. You don't need an
Hmm.
esthetician license. You need to pass a bloodborne pathogen exam.
A bloody procedure,
It is,
actually,
and this
because
is
you,
why I'm shocked that also that is not that are managed because, I mean, someone has a surgical blade next to your eyeball and is going to cut into your skin. So and I think just passing a bloodborne exam online with probably also multiple choice questions is not going to prepare you for what might happen afterward, what might happen during. Just so many things are wrong with that picture.
I was actually quite surprised when I found out about microblading when I first started in aesthetics 10 years ago. I kind of have too much in the way of eyebrows, so I don't really need that service myself. But I was really surprised at how many people were doing it.
Mhm.
The thing that strikes me about microblading is the outcomes are not so pretty a lot of
No,
times. So I've seen a
not.
lot of bad microblading out
Yes.
there. I just had a patient yesterday who last time I saw her had just had it done. And this time she somehow had it reversed. I'm not really sure what they do to reverse it, but she was very unhappy with the results. So she undid it, which I didn't even know you could do because it's a
Well, probably
tattoo,
through laser.
really.
I would imagine through laser the same way they use remove tattoos.
I
Laser.
know, but you would really risk your own eyebrow hair
Oh,
with that. So
yes.
I'm not really sure how that's done.
I also wanted to mention that earlier we were talking about medical estheticians in Washington, and I know that Washington licensing is a lot more stringent than here in California, and everyone thinks we're very we're California's a lot too many rules. However, not in this case of estheticians, because to be considered a master esthetician in California, you can just call yourself a master esthetician here, or you can call yourself a medical esthetician. In California, the definition for a medical esthetician is simply someone who's completed the aesthetics program and passes the exam. So it's an esthetician. You're an esthetician, but you can just magically add the word medical.
Well, actually, my lawyer, who I've interviewed on this podcast, has made it a point many times that calling yourself a medical esthetician in most of the country could potentially get you into major legal trouble.
As it
because there is no such thing. And you can't use that term in Washington. You can use the term master esthetician if you have that certification,
okay,
but
yes.
you can't actually use the term medical
I
esthetician.
see. Mhm.
And I don't know that actually exists in any state. And there are not very many states that have master esthetician training either.
No,
And there
New
are
York
some
State.
states that have the term laser technician,
Right.
although that's also pretty rare. I think Colorado has laser technicians, but they're not estheticians
Yeah.
necessarily at all. They're
Yeah.
laser tech.
The master's esthetician licensing is only available there in your state, Washington, the District of Columbia, Minnesota, Nevada, Oregon, Utah, and Virginia. So in every other state besides those, you can call yourself a master esthetician without having any actual proof that you've had the extra hours of education in different modalities and treatments. So
Mhm.
it's a term you can kind of throw around, which impresses people, but they don't really realize it doesn't mean much.
I think that one thing I've been stressing in this podcast is when you are having any kind of medical procedure, that has to be prescribed by a physician or a mid level provider who's working under a physician.
Right.
And it has to be carried out by somebody with credentials who can legally carry it out.
Mhm.
In most states, estheticians wouldn't be able to do that. But in those states that you mentioned, and I'm sure that there are probably some other designations in other states that I don't know about. But I think it's really important to stress that if a esthetician is practicing medicine on their own, which is very common out
Yes.
there, they kind of want to go past the level of what they're allowed to because they can charge more money if they do, say, microneedling. I would say microneedling is probably the number one common thing that estheticians can order a non FDA approved microneedling pen off the internet. They're super cheap. They're from China. They're like a couple $100. The tips
Right.
are super cheap. They're
Yes.
not well made. They might not be very sharp. They can leave little shards of metal in your face. They're not very well calibrated, so it's hard to tell what depth they're at. Legally, they're not allowed to go deeper than the epidermis, which is just the surface
Right.
with any kind of microneedling pen, but they routinely, and you really can risk getting like a rip roaring infection of your skin, which is called a cellulitis. You can risk getting really terrible reactions to the products they're using because
Yes.
those products now have access to the inside the skin as opposed to the surface of the skin. And then, of course, they don't have any medical knowledge to be able to treat any of that if any
Right.
of that were to
Right.
happen. And it's become very common.
Yes.
To
And just speaking with my students and hearing them talk to each other, there's a whole genre of estheticians practicing these kinds of things on Instagram with no license, no certifications, and they're using these devices on clients without having any real, even basic knowledge of sanitation and sterilization, much less what to do if there's a complication from that, such as vascular occlusion, like you talked about on one of your other episodes. Vascular occlusion can occur using the
it's
hyaluron
a
pen.
Hyaluron pen.
And I do have one of the lash tech. She's non-licensed and she does that out of her home. And she was also offering the hyaluron pen treatment until I
Which is
explained to
completely
her.
illegal.
It
So we won't say
absolutely,
who this person is, but
yes.
I actually have seen a Hyaluron pen vascular occlusion caused by someone who ordered it off the internet. So it's not legal.
Yes.
They're not legal here, but
Not at all.
she ordered it and she actually tried to do her own lips and face and she gave herself an occlusion. And it took us 3 hours to treat that and get her blood flow back to her face and her nose. And she was okay, actually, thank goodness, because
Right.
we were able to treat that in time. But if anyone is offering these treatments, an esthetician, so the Hyaluron pen, or if they're offering you what they call needleless filler, so filler without any needles, totally illegal. The plasma pen, illegal. There's a nano pen you
Yeah.
mentioned. That's a microneedling pen. There are
Very
actually
popular.
many microneedling pens that are super cheap and that you can get at home. The ones we use are very well made and they're FDA approved and they're expensive. I believe a brand new one can be anywhere from $4,000 to $5,000. And then each little tip that we use is sterile. And then, of course, we throw it out because you can only use it once. I would be very worried that these people, if they're cutting corners in all these other ways, how do you know that tip is sterile? How do you know that they're throwing it out? how do you know that they even know what they're doing?
Exactly.
How do you know the quality of the tip? And
Yeah.
it's crazy. Plus, they can't legally access numbing cream either. So we use really strong topical numbing so people don't have any pain with microneedling. If you're not a doctor, you cannot access that. No compounding pharmacy will hand you a
No.
really strong anesthetic. So they would be using, the most you can buy as an esthetician is a 4% topical lidocaine, which is
Right.
basically nothing.
Right.
It will not be numb for that. It will really hurt like the dickens.
Mhm.
So all of that really should not be in the hands of a non-medical
Not at
person of
all.
any kind.
But then when you mention the price of the equipment and how expensive it is, of course, that's why these treatments are not cheap as well. I believe what I'm seeing is that the consumer just hears about these types of treatments. They see something online and it's offered as cheaper, and they'll immediately just go for the cheaper price, not realizing that this is a potentially dangerous procedure.
Yeah. Well,
And
I
it's
don't think people
medical,
realize the risks.
right? Mm,
Microneedling, how bad can it be? I think the
yeah,
biggest thing that we've seen from that is really bad rashes and breakouts, but
yeah,
then also infections. I
correct.
haven't seen that very often, but a couple of times infection from that.
Well, I spoke to you earlier about a day spa that I worked at where a client got a staph infection on their skin. So, and that was before microneedling was even a thing. But imagine if you had gone to an esthetician who didn't properly sanitize their sponges and it had staph, and you had the microneedling done first, and then staph infection introduced into that. This particular spa ended up paying $10,000 to the client to make it disappear. But after that incident happened, the management was not willing to call the staff together and go over sanitation and sterilization procedures because clearly something was going on, but it was completely glossed over and not even addressed. And in that particular spa as well, I did body treatments where you would do a scrub on someone, let's say in a Vichy shower room, and you would get your product from a large tub and you'd put it in a bowl and you'd use it to scrub the client, their feet, their private parts, their everything you can imagine. And then you may or may not have some product left in your bowl afterward. Well, common sense would tell you you throw that product out. However, I did enter the room to prepare for my client when someone was cleaning up after theirs. And this esthetician was pouring the leftover scrub from her bowl back into the bulk container. So when I addressed this to her, she had no idea what concept I was trying to explain to her about why that would even be wrong. And when I went to management about it, it was kind of brushed under the carpet. And after that, shortly after that was when the staph infection situation came up. And then the way it was dealt with by management was completely inappropriate. And I left that spa because I didn't think that I could even keep myself safe as a practitioner if those kinds
That
of
that really sounds disgusting.
it was
All
horrible.
right. So,
Horrid.
for anyone who doesn't already know, a staph infection refers to Staphylococcus aureus, which is a bacterium that causes skin infection pretty commonly. That's the most common skin infection. People in the hospital sometimes develop a staph infection. That's because someone didn't wash their hands or they didn't change their gloves. So what you're describing sounds so putrid. They've got product in a bowl and they don't want to waste it. It's been contaminated with someone's private part goop, and now you want to reuse it, which sounds insane to me. But if so, one of the things I wanted to ask you is obviously sterility and cleanliness and cleaning is part of the education for estheticians, I'm sure. But
Yes.
the part that I feel is really important for people to understand is that there's a difference between doing something clean and then cleaning it up and knowing about bacteria, contamination, and sterile technique and stuff that we learn in medical school that's really hammered in. Like
Yes.
you learn about, so there's bacteria everywhere, all over your skin, in your mouth, in all your parts. And the moment you touch something, it's contaminated now.
Yeah.
So if you have sterile gloves on and you accidentally touch something, you got to change your gloves.
Right.
Even if it's a clean thing and it was just a tap that's contaminated, you got to get rid of your gloves and start over. Scrubbing for the OR takes like a good 15 minutes. Okay. It's very elaborate process of making yourself sterile so you can walk into a sterile room. If you lower your hands 1 centimeter too low, then the OR nurse will scream at you, get out, go rescrub. And the moment that happens to you, you're never going to forget that. Right. For the most part, estheticians don't know about that. You don't go through that kind of training, right?
Well, interestingly, when I went to school, that was what they drilled into you the most, more than anything else, was sanitation and sterilization procedures. And that was 90% of the practical exam that we had to perform for the state board examiners. That was what they were looking for, is if you understood the very strict difference between clean, sanitized, sterilized. They're
Mm.
all different things. Unfortunately, estheticians now are even less educated in that way. I do stress that a great deal in my classroom, but it's definitely not drilled into the way it was when I was in school.
Yeah, and I think that's really important. I mean, certainly for my practice, we
Absolutely.
have our staff meetings and I talk about all these things over and over to make sure I'm knocking on wood on these podcasts quite a bit here, but knock on wood, we haven't had any infections that we've caused.
Yeah.
Thank goodness. We've treated a few that just walk in the door, but generally we don't do dermatology, so we're not generally doing that.
Right.
But it's so important because you can have a facial, but somebody is using contaminated product that would be
Right. With
potentially
mold
you
and
get
stuff.
an infection just from a
Mhm,
facial.
mhm.
Have you seen other complications from facials, from the peels used or from the
I've seen
products used?
I've seen a lot of complications from microdermabrasion because of person not being trained correctly or using the improper products in combination with the microdermabrasion, or just not understanding the different types of skin, the Fitzpatrick differences in the skin type, and so using it on someone it's not appropriate for. So, and microdermabrasion has certainly evolved since I was first introduced to it over 20 years ago. We don't normally use the crystals anymore. It's different. But so I have seen some pigmentation that happens after that with those kinds of things.
You've seen hyperpigmentation after
Absolutely.
microderm?
I've seen it after microderm. I've seen it after chemical peels. Well, sometimes just because the client themselves are not compliant with the instructions. Because I even saw that with plastic surgery clients that would get a peel and then become more sensitive and then end up with worse hyperpigmentations.
Is that from picking at the peel or
It's from not staying. Well, you would tell your client, you need to stay out of the sun, like,
right?
completely, and they would just say, "Oh, well, I just drove to the grocery store." Well, and the left side of their face,
And
like,
with no sunblock on and
even if they use the sunblock, there's a certain period of time where they just shouldn't be in the sun. You're in Seattle, we're in Southern
mhm.
California, and I'm telling you, the sun is very strong here. Every person you see down here who's driven on our roads for a number of years has on the left side of their face much more aged, including me.
Yeah. I used to when I first started 10 years ago, I had a picture on my website. I don't know where this went. I think it was a stock photo
I
older,
showed
and
it.
his whole left side of his face
Yeah.
was way more damaged and not just sun damage,
Yeah.
but more wrinkly, more droopy, more everything
Right.
because
I
of the
just showed
sun.
that to my students the other day. That's so funny.
Yeah, that's a great photo. If you still have it, you should send it to me.
Well, then I compared my own face, which I showed them the differences in each side and the loss of collagen and elastin in my left side and so on. So they had like a live demonstration of the perils of sun damage. So
Well, that's a great teaching tool.
yes.
I guess it's worse in LA where the traffic's just so heinous. You're 3 hours in
Yeah.
the car every day.
And you much more you more often see people starting to wear gloves. I've worn driving gloves for probably almost 10 years now, but it's becoming much more common to wear. There's all kinds of short gloves, long gloves. You can wear
Do
one.
you wear them just on your left hand or
You wear them on
just
both, because if you have both hands on the steering wheel up here, and hats and drapes even across the face, all kinds of things. So
Have you ever seen any, issues or complications from places that are using just low-level products in their facials? I mean, I'm very particular about what we use for our facials. We have a medical facial, and we're doing, essentially trying to do medical treatments as part of the facial. So we're treating acne, we're treating rosacea, we're treating melasma. So a lot of places around here have, I would just say, not medical grade product. People tend to get more reactions to them, more rashes, more breakouts. Some people just say, "Oh, I'm so sensitive," because they had an issue after a facial and they've been fine when they've come to us, but really it was because the place was using kind of subpar products. Have you seen that much?
very much so, especially as we discussed how the industry has changed with people starting up an Instagram page and then instantly having a business. Those a lot of those people are not because they haven't been trained in a spa. They haven't worked for a long period of time. They just go into business for themselves, so they're not going to be able to have access to those lines because as you know, there's a fee to start carrying that line. It can be in the thousands of dollars. You can't just order one product. So they'll go to the internet, and as you said, you can buy anything on the internet. Hyaluronic acid, you can buy glycolic, you can buy all kinds of basically anything. So that's what they'll use is a little bit of this and a little bit of that. And it's not necessarily a cohesive line products and not products that are tried and true products that you can research and actually know where they come from and how they're made. So again, that same issue with a lot of the Korean skincare right now, which is very popular. And
Right. I think that one of the things that I learned 10 years ago when I started this is not only the active ingredient. So let's say you have a 30% glycolic
right,
peel. So that's important to know, but it's also really important to know what all else is in the goo because there's carrier molecules, there's
exactly.
filler. If you get a compounded drug, it's called the base, right? So you have the active ingredient that you need and you're putting it in a base. And every compounding pharmacy has a different base and they all have different ingredients. And some of those ingredients are very irritating, some are not.
Yes,
Some cause acne, some
right.
don't. Some can cause reactions in various kinds of skin and others don't. And so when you're ordering off the internet and you're just getting some generic thing from God knows where, probably China, then you don't know what the base is. You don't know what those other ingredients are.
Absolutely. Right.
And it is quite expensive to get into all these skincare lines if you're getting into a medical grade skincare line, which I know I've said this at least once on this podcast before, but there is no official definition of medical grade. But my personal definition, the Kate D definition is did the manufacturer do laboratory studies to prove that the thing is what it says it is and it
Yes.
does what it's supposed to do? And
Yes.
there are some really fantastic companies that make really quality skincare that have done just that and actually make really fantastic products. And I would call those medical grade skincare
Mhm.
products. And I would call basically everything else isn't. Doesn't mean everything else isn't good, but
Right.
it hasn't been proven, it hasn't been shown to be good. And it is more expensive to use the medical grade products.
Mhm.
There's no question, right? So, but if you're going to a place that basically doesn't have a website, is not listed on Google or Yelp because you know, it's in someone's backyard, or even if they have a location, but they don't want to be
Yep.
found by Google or Yelp, if all they have is an Instagram page and you're going to this person who may or may not have a license, you're risking your skin, even if you're just having a facial.
Oh,
Um,
absolutely. And not only just your skin, but as we discussed, if you're using devices you shouldn't be, such as microneedling hyaluron pen, like we discussed, there could
mhm.
be like serious complications. So,
My hope is that if you're going to go have a facial or a dermaplaning or a microdermabrasion or a light peel, any of these aesthetic services that are not medical, that you ask those same questions, right? What's your certification
they
and
should
where do
have
you get your products from?
exactly.
And make
Exactly.
sure it's a real licensed business,
Right.
legit business.
Right.
Because if you have a Google profile, and Google will find you, so will Yelp. So even if you don't want to own your Google profile, if you don't take it over as a business, they will find you and people will start reviewing you.
Mhm.
But if you manage to stay off the grid and you can control everything on your Instagram, somebody says something, you just delete that, then you won't have any negative reviews. Nobody will know that someone
Mhm.
had that.
Exactly.
Is there anything else that we haven't talked about or any of your stories that you haven't mentioned yet that you'd really like to tell?
I've seen practices in spas, and I also, again, to reiterate, a high-end five-star, five-diamond hotel spa, another place I worked at, and corners are cut. Clean linen isn't always used. It just buyer beware. This is all I have to say is buyer beware because you just don't know what a facility is like. And keep your eyes open and look around you and make sure that everything, at least like when you go to a restaurant, you don't normally want to go to a restaurant if the floors and the walls and everything else is not clean. Just your eyes, but you still buyer beware and make sure that person, don't be afraid to ask the question, how long have you been practicing aesthetics? They should have their license displayed in their room. This is California law. You need to have your license displayed in your room so that you can tell. These are just important things the consumer needs to know because it's an industry where, in med spa industry, things are just not taken seriously as they should be. Injections, Botox fillers, facial treatments, things like that are not just foofy, feel good, instant gratification type of things. You need to make sure the person who's performing these procedures is qualified and experienced.
Exactly.
I see so many of these students, they all want to go into business for themselves. None of my students want to work for another person. And I keep having to explain, you have to do that before you can go into business for yourself. You learn from elder esthetician business practices. You're trained by a lot of products so you can get advanced training from those places. It's fun to think you want to go into business for yourself, but in this type of industry, you have to learn. You have to have experience. You have to work under someone with experience to be able to be trained on this, because just graduating from school even doesn't really make you qualified esthetician yet. You really need to have that experience under someone else who's experienced.
Yeah, I couldn't agree more. And I don't have any regular estheticians in my practice. I have 3 master estheticians. I feel like it takes many years to learn everything there is to know. It's like doing an apprenticeship or a residency,
Correct.
not to mention the business part and the legal part. Interestingly, people don't know what they don't know, right? So
Mhm.
they start out with a business and, some people don't know they need a business license.
Correct.
Some people that don't know that they
They need
need a special spa license. In Washington, I actually have a special salon shop license in order to perform facials. I actually, other than my medical degree, I don't have to have any other license to practice medicine or do the lasers or any of that. But I have to have a special cosmetology salon shop license, and they actually will inspect my spa, but only the facial room. So we do mostly medical. We have one room for facials. And in the 10 years I've been open, I've been inspected twice now by the cosmetology board. And what they're looking at, I got a 98 on the last one, and there were 2 small waste paper baskets that didn't have lids on them.
Mhm.
But otherwise, I passed with flying colors. It was really interesting because in the next room, I got several lasers that could blind you, but nobody's inspecting that. It's my license on the line, so I care. But there is really no enforcement of any rules or laws around any of the other stuff. The facial room, that gets inspected.
Well,
Um,
what's interesting too, though, as you said, 10 years in business, they've only come twice.
yeah, well, I think they're very short staffed.
It's same thing in California. I think maybe even worse. I know in my practice, when I had my own practice, I was visited once in 8 years. And the spa and all the spas I worked at, maybe 2 of them out of over a dozen were ever inspected. So like I said, a place can have a great reputation and be in business for 45 years, and they're not cleaning out their hydro tubs. So you're sitting in a tub of other people's dead skin cells and bacteria. Honestly, I'm going to be honest, Dr. Kate. I know of a spa where I worked. This is awful. They paid off the inspector.
Oh my gosh.
Absolutely paid off the inspector.
Where they were about to fail and they paid them off?
Well,
Or
they had been, I guess they had been, this was an established spa over 30 years, and I believe they had some kind of, it was maybe the same inspector, but I hear they had some kind of relationship with this person, and so this is the same spa that I told you with the hydrotherapy tub and the don't change the sheets because the client doesn't really touch them. That and refilling the containers with the mold on the bottom, that place. So I'm sure they were out of compliance and they somehow worked it out. But from then on, I guess it was a regular thing that if and when the licensing came, it was just a $800 under the table and
they didn't
they
actually
didn't
even
inspect.
inspect it?
They wouldn't inspect. So
Well, that's fantastic. I think that just proves kind of my general premise here with the book and the podcast, and that is if somebody is cutting corners in one area, they are probably cutting other corners too.
absolutely.
And it might be one area is low risk, but the other area is not. And
Mhm.
I would not take my chances. Even if you have a facial and you don't get a rash and it was fine, they are still taking that risk. And you might not be the person who ends up with the rash, but the next person with a little more sensitive skin
Mhm.
may, or if they have a cut that they didn't
Yeah.
realize and the cut gets infected with the
Mhm.
staphylococcus and now they've got a staph infection.
Right.
Yeah. I mean, if you have any open sores or acne or a cut or, then that bacteria could be entering into your
Yeah.
skin,
Especially acne.
especially acne. Yes.
Mhm.
So you had one more thing you wanted to add?
I think that there's a difference between certification and actual licensing. So, as I mentioned before on Instagram, you can get a paper certification saying to do microderm. You know how to do other types of modalities. It doesn't necessarily mean you've been trained in that and know what you're doing. It just means you went online and you paid 17 or $28 and you got this course and now you're certified or you're
Yeah. And that's sort of a fake
it is.
certification.
It's all fake.
Yeah.
Yeah.
I mean, honestly, you can go and just print out your own
Yeah, you could print it out on your own, right.
you go into Canva and print out a certification, and that'd be just probably similarly valuable. There are, believe it or not, doctors who produce their own fake board certification. That's a thing too. I write about that in the book. Yeah, I mean, you really have to know that they've got a real valid board certification from a medical board or a real license from the nursing board or the cosmetology board. That's what's real.
Very true.
I really appreciate your being here today and talking about these things. I think that it's been really educational for me, and I hope our listeners have learned something too. So thank you so
Yes.
much, Elizabeth.
You're welcome. It was my pleasure. I look forward to hearing more of your work in the future as a disruptor in the industry who's doing really important work.
Well, I hope not so much disruptor, but educator. And if
There you
people
go.
go out
Exactly.
and ask all the questions, then the
Right.
people cutting corners just won't have so much business anymore.
Right. Right.
Hopefully, you can come back sometime in the future and we can have another conversation. It's been great.
I would love to, Dr. Kate. Thank you so much.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website medspamayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.